Trinidad and Tobago is a true island paradise, full of beauty and Caribbean splendor. But beneath the lovely surface, our tropical oasis faces a devastating problem.
We have seen the increase in non-communicable diseases with an increase in lifestyle inflation, so to speak. The more monies we get, is the more we spend on processed foods, high-fat foods, high-salt foods. And with that comes increased prevalence in non-communicable diseases. So you have less income coming into your households. You have poor choices because of the less monies coming in. Even at the workplace, you have less productivity, and of course that impacts us on a national level in terms of the presenteeism and absenteeism of a number of these persons who say they suffer from these NCDs, but it's not suffering with it, but it's more or less living with it. So what we're finding is that with the increase in NCDs, there is a reduction in not only quality of life, but also the lifespan of persons, as well as it affects the national economy going forward.
In response to these worrying statistics, PAHO and the Ministry of Health have introduced a training exercise designed to empower individuals to be better able to manage their chronic health conditions.
Let us say a typical patient goes to the health center or his doctor and is given a prescription and goes back home and manages himself and come back 3 months later or whatever time the appointment is. And what happens when he leaves the office and goes home and come back? That's the self-management interval.
I am extremely happy to have been part of the self-management training program. This program has assisted the Health Education Division in fulfilling its mandate of empowering persons to achieve well-being.
My motivation was to seek good and useful knowledge. With that knowledge that I have gained, I was then able to impart it onto my family, my community, and hopefully one day to my nation at large. The difference the self-management course have made in my life is that I was able to recognize that little things make a big difference. The little things as reading food labels can impact your diet choices. Positive ways in which you can learn to manage stress levels in everyday life, both physically and mentally. Simple things as exercising can help reduce your stress level and also improve physical health. Our tutors were able to teach us this and so much more over a 6-week period online.
Lifestyle changes are not easy, especially when a person is living with chronic health problems. Telling someone to increase their physical activity or eat healthier is not enough when the person feels that they cannot make that change.
PAHO, the Ministry of Health, and the new leader trainers are extremely happy for the course and are already applying what they have learned in a practical sense.
We give persons the tools, we explain why they are needed, and we go through a process of helping persons to understand what they are and when they can be used. And then we found that by going through this process, it allows persons to make the individual lifestyle changes that they need to make without us directly telling them, you need to do X, Y, Z.
So the 20 folks that we have trained, that we refer to as master traders in inverted commas, they now will have the responsibility to train in the next 6 months, by the end of the year, 2 groups of 20s. PAHO has already agreed to help us along this journey to increase momentum in getting the self-management training elements embedded in any community that they come from. So it's better to have people trained and go back to their own community to take the message across. We're going to be monitoring and evaluating the activity.
What's even more interesting is in some cases, the training had impact both professionally and personally.
All chronic diseases put a strain on health systems because it's for a long time that money has to be invested in taking care of persons with hypertension. We're talking about hearts, disease. We're talking about diabetes management, for example. So both the quality of your life as well as the cost of the healthcare system, because more and more money has to be poured into it in order to be able to take care of you. So this is something very close to me in terms of understanding from the inside how chronic diseases affect persons on a day-to-day basis. And it's not just the individual, it's the family and collectively the community. And this goes all the way up to the nation because of the kind of investment that one has to make in chronic care disease management.
Having taken part in this program and having realized the benefits of the program and its usefulness, I see myself as an advocate or as a mentor to other persons with chronic illness who may be struggling to manage their condition. And I would like to help train them, other persons, and in addition, the wider community, because the more persons benefit from this, it will be like an explosion. It is going to expand, persons are going to benefit, the community is going to benefit, and illnesses will become less challenging to our population.